is going to be hard. I actually feel like I'm shaking.
Do you?
Suddenly, yeah.
Right, let's put the headsets on then.
Oh, Lord. That's unbelievable.
This is your body.
Yeah.
So this is how your abdomen's currently coming out. You can actually see your belly button.
I can see that now, yeah.
Just there.
Does this kind of feel like your body? Because
It does indeed, because, you know, I've got that protruding belly, and that looks exactly like me.
Yeah.
That's scary, but very interesting.
You look at that, you can see the burden
Yeah.
in every sense she's been carrying.
I want her to know what she's carrying, because we call it a monster, because it feels like she's been pregnant for a long time without actually having a baby.
for Hilda to find out exactly what's causing her swollen abdomen, she needs to take a closer look at her uterus, as this is the organ where fibroids develop. But first, Mr. Quinn wants to show Hilda what a healthy uterus looks like.
So Hilda, what we can see here is a uterus inside the pelvis. So this is a normal-sized uterus. So that's the sort of space that a uterus would normally occupy.
I think what is interesting here is if you look at it, the uterus is really low down in the pelvis. It just sits very kind of tucked in and away and out the way. Now, I would like to show you what your uterus looks like. And I know that you're really keen to see it.
Yeah.
But it might be difficult for you to see this next image, so I want you to be prepared and ready for it. And I'm going to show you your uterus here, just next to the other one, so you can see what they look like side by side. Yeah?
Let's go for it.
Yeah? Okay then.
A gynecological problem of fibroid uterus.
It's
Huge enlargement
That's
of
scary.
the uterus and bleeding problems.
So Hilda, what
In
we're seeing
first
here
case.
is your uterus. As you can see, it's unfortunately extending well out outside the bones of the pelvis.
oh my God.
It's terrifying, isn't it?
It's real images.
Those are real images.
When compared to a healthy example, Hilda's uterus is 40 times the size and taking up most of her lower abdomen, similar to carrying a full-term pregnancy. I can see from your reaction that it's a bit of a shock.
This is very shocking.
What are you thinking right now?
You know, the graphic reality of what is sitting inside my belly is shocking. Having seen the normal one and compare, it's like an inflated balloon. It's enormous. It's too big. I wasn't expecting it to be that big. That's scary.
I'm sorry, I know this is a lot to take in.
Yeah, I'm fine.
Oh, bless you. Thank you.
How did he get to that point?
Do you think she's all right?
I don't even know how she...
Coping with it?
I did not expect anything like this.
Yeah.
So painful. It's created a lot of negative impact in the way I live my life. It's kind of taken away my self-confidence in a way. And that means I've kind of limited how much I interact with people, you know, where I go to and who I want to be around. It just takes away your youth. It takes away your social life. It takes away your happiness in a way, because it kind of prevents you from doing most of the things that you really want to do.
It's hard for best friend Lua too, who's seen Hilda struggle every month with increasing abdominal pain and heavy bleeding.
I knew, because we were close, that she had times in the month that she'll be in pain. But at the time, we didn't know what it was. All they said was, it's just painful periods.
Hilda received her fibroids diagnosis a number of years ago. While the monthly pain and bleeding were manageable for a while, recently her situation has worsened, along with a dramatic change in the size of her belly.
Each time I meet new people, I always get the oh, congratulations, wow, you're glowing, or when is baby coming, things like that, which is incredibly stressful. When I look at this picture, I feel sad inside. Cannot wait to just wear a little dress and not worry about my tummy bulging out.
Unlike most women who only experience mild symptoms, Hilda's fibroids are causing significant distress and pushing her belly outwards. At our imaging centre, the doctors want to help her understand exactly why.
Let's put the headsets on again. Come and walk with me and just have a look at it from all sides and just see exactly what's going on here at the back.
Taking away Hilda's healthy uterus tissue reveals just what's causing it to be so enlarged and misshapen.
Stephen, can you just tell us what we're looking at?
So Hilda, this is what's been causing that enlargement of the whole womb. You can see that large fibroid there separately at the top, and that's just sitting there. Again, you can see each one of these individual fibroids sitting on the outer portion of your womb. And then within the uterus, you can see these smaller fibroids inside.
Bowl-shaped benign tumours or fibroids are growing throughout Hilda's uterus, on the surface and inside, stretching and deforming it to a huge size.
There's a lot of big ones.
Oh my goodness.
Maybe you can just show me on your own tummy, actually. Where do you feel the fibroid?
I feel you see the one at the top, it's one big fibroid, but there's one on the side, there's one at the top, and there's another big one, my lower abdomen.
And so you can feel all of that in there,
I
can't you? Yeah.
This one, I feel it all the time sitting there, and the one on the
And
side.
that's this one up here at the top, which you're feeling. And then at the front, yes, you can feel these other ones. And Hilda, if you come round and just have a look from the side, you can again see how this would be pressing on the front of your abdomen.
How do you explain how it got to this level?
That's a very good question. We don't completely understand as yet why fibroids grow. There are a lot of theories about that. We know that fibroid growth is related to estrogen, and that's one of your main female hormones that drives the growth of these. Some individuals are more susceptible to fibroids, so sometimes there can be a family history of these types of fibroids within the womb.
As well as a hereditary link, fibroids appear to be more common in women early to start puberty or who haven't had children. During menopause, the drop in hormone levels may cause existing fibroids to shrink.
Stephen, to me it looks like there's a huge number of fibroids in here. I mean, how many do we think Hilda has?
We believe that there are just over 90 fibroids in total.
And that sounds like a lot to me. How much would you say is normal for a woman who has fibroids?
So most of the women I see with fibroids may have 5, sometimes 10 fibroids. So this really is an awful lot to have inside the womb.
Hilda's case is extremely rare. Of women who do have fibroids, just 1/3 will suffer from any symptoms. But if you are worried, always consult your GP.
That's unbelievable. And it's just all over the place.
It's unfathomable, isn't it?
This is one of the most challenging examples of fibroids Mr. Quinn has ever dealt with. The big question remains, what on earth can be done about it? Can they actually even be removed?
With cases like this, it becomes much more complex where there are very many fibroids, and the size of those fibroids has enlarged the uterus to really a very significant size.
Oh my God, it's a monster.